hope you're doing well, staying healthy and safe. This is part 2 of understanding and managing high blood pressure. In this video, I'll be talking about treating high blood pressure without medications, which is the non-drug or non-pharmacological way. If these measures don't work, then what medications to take to treat hypertension? And in the end, we'll have the quote of the day. So let's talk about high blood pressure first. The first step in managing hypertension or high blood pressures is lifestyle modification. That includes, number 1, either limiting salt or sodium intake, or you can replace the salt with potassium salt. Sodium is the salt that we normally use in our diet, and I'll be using sodium and salt interchangeably. Potassium is also a salt, so the taste of food will not vary as much. Potassium salt should replace sodium, which is the regular salt, unless it is contraindicated by presence of chronic kidney disease or illness, or the use of medications that reduce the removal or elimination of potassium from the body. High potassium levels can be life-threatening, so check with your doctor before starting potassium salts. If you want to limit the regular salt instead of taking potassium salt, then cut down on sodium to 2,000 milligrams per day, which you have to calculate and look at every label of everything you eat and drink, since they all have sodium or salt usually. Or the easiest way is just reduce the salt you put in while making food to half, and no sprinkling salt later on the food either. Number 2, DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. The DASH dietary pattern is rich in vegetables, fruits, low-fat dairy products, whole grain, poultry, fish, nuts, and low in sweets, sugary drinks, and red meat. Consequently, the DASH dietary pattern is also rich in potassium, magnesium, calcium, protein, and fiber, but low in saturated fat, total fat, and cholesterol. So it's a healthy diet. Number 3, weight loss in overweight or obese people can cause significant drop in blood pressures regardless of exercise. Number 4, aerobic exercise including running, jogging, swimming, cycling, walking, and possibly resistance training. Number 5, limit your alcohol intake. Women who consume 2 or more alcoholic drinks a day and men who drink 3 or more drinks a day have significantly higher chance or incidence of hypertension compared to non-drinkers. These lifestyle modifications that I have mentioned can help control blood pressures. Sometimes these modifications cannot be followed for different reasons or are not enough to control hypertension. That is when we use medications. When I'll be talking about medications, I will be using medical terms, simply because those are the names of the medicines or the groups they belong to. Some of these medications that are commonly used to treat hypertension or high blood pressures include diuretics. These drugs make you urinate more than usual. Angiotensin converting enzyme, also known as ACE inhibitors or angiotensin receptor blockers. These drugs can help prevent kidney disease. Doctors often prescribe them for people with diabetes because people with diabetes have a higher than average risk of kidney disease. Also, people with heart failure who take ACE inhibitors live longer than people with heart failure who do not. Then we have calcium channel blockers. Also, beta blockers. They're pretty good in controlling high blood pressures. In addition to lowering your blood pressure, they can help reduce the amount of work the heart has to do. Studies have shown that people who take beta blockers after a heart attack are less likely to have another heart attack or die than people who do not take beta blockers. Studies have also shown that people with heart failure who take beta blockers live more than people with heart failure who do not. To To sum up, normal blood pressure is equal to or less than 119 by 79. Hypertension or high blood pressure is diagnosed when blood pressure is equal to or greater than 130 by 80. Risk factors include advanced age, obesity, physical inactivity, excessive use of alcohol, genetic predisposition, high sodium or salt intake. Some medications can also cause hypertension. If you have hypertension, see your doctor regularly. Management includes lifestyle modifications, DASH diet, limit your salt intake, lose weight if you are overweight or obese, exercise, reduce alcohol consumption, take medications regularly if your doctor has prescribed them to you. This will help control your blood pressure. And now, the quote of the day. The worst person is the one whom others are afraid of. Some of us think that if people are afraid of you, that is a good thing. That is a sign of respect. It shows one is strong. That is actually not true. People are afraid of scorpions, snakes, bears, sharks, etc. because they feel these animals are not smart enough to understand and not attack. Similarly, if people fear a person because of his wealth, power, or social status, it is because they feel this powerful guy is not smart enough and is like an animal and lacks mental capacity, compassion, humility, kindness, and other great qualities that make us human. So make sure people don't fear you. Respect and fear are opposite. We'll talk about respect and fear in another video. Please subscribe to this channel for free to stay informed every time a new health video is uploaded. Thank you and stay safe. Bye-bye.
If you liked the video, please subscribe, like and share.